So I'll go ahead and just kick it off then so that we can be mindful of everyone's time. So good afternoon, everyone. I appreciate you all joining today. We are overly excited to be a part of this, not only just for Vizient and contracting with Alister, with American Medical Exchange for two contracts that we have today. One is for med distribution, as well as we have another one that Alister has partnered with ActivePure. And it's such a great product. And so today we're going to just go through a webinar. We'll have some panelists here. As you can see, we have Dr. Deborah Birx. We also have John LaRochelle, as well as Dan Marsh, that is at ActivePure, Marissa, and Alister. And so we look forward to this call of just going through some of the things to consider as you're going through managing the infections and just some tips and tricks as well. And so I appreciate your time, and I'll go ahead and kick it over to Alister.
Oh, thanks a lot, Brittany. I really appreciate it. And thank you all for joining us today for our presentation on stopping pathogens in their path. It's going to be presented today by ActivePure, as well as American Medical Exchange, and it's featuring Dr. Deborah Birx, Chief Medical and Science Advisor at ActivePure, and also John LaRochelle, who is President of Lighthouse Environmental Infection Prevention, and Dan Marsh, President of ActivePure Medical. But before I formally introduce Dr. Birx, I just wanted to remind you that within the Zoom platform, there's a Q&A chat feature. So if you have any questions for our panelists, please go ahead and enter them in, and we'll address them after the presentation. Our first presenter today is Dr. Deborah Birx. You guys all know who she is. She's a world-renowned medical physician and expert on infectious diseases, and also a diplomat who has served as a special representative for the global health diplomacy. Her 3-decade-long career has focused on immunology, vaccine research, and also global health. So Dr. Birx, I want to thank you for joining us today. We're really excited to hear what you have to say, and you're welcome to share your screen and go ahead and begin.
Thank you, Alister. It's really a pleasure to be with each of you today, and to really thank everybody who's been on the front lines of the healthcare over the last 20 months. It's been enormously difficult. I've been on both sides of that equation. I was at the front lines, but then I was also, my father was admitted at a hospital and then rehab for almost 3 months. So over the last few months, I've been able to witness this up front. And I think everyone can understand the stress of the staff. Even in between COVID times and between COVID surges in your counties and in your communities, there has been real health concern surges into the hospitals. So next slide. So where are we in COVID today, and why is this continuing to drive issues at the hospital level? I know you've been tracking that there were over 9,000 COVID-induced HAIs in the hospital for many reasons, one of which is many individuals, even though vaccinated, may become asymptomatically infected. So once again, with hospitalizations rising, particularly that top line is people over 70. We know that their care is complex in general, and even more complex with COVID. And so that continues to be the largest age group. 85% of the deaths are in people over 65, and care for those over 65, as you know, is complicated and time consuming. And so the stress on the healthcare system is going to continue as these surges continue throughout the United States. Next slide. So just a summary of what you all have lived. With each of the surges, we've lost significant number of Americans. From 100,000 with the first surge to the first summer surge, we lost 100,000 Americans. And now with the last summer surge, we lost almost 130,000 Americans, despite having an underlying 40% vaccination rate across the Sun Belt. And I think everybody wants to know what is going to happen right now. Potentially, we could lose 120,000 lives over the preceding 2 weeks and over the next 8 weeks as we move through what is a Delta surge right now. We could see the Omicron variant within the next 4 to 5 weeks spreading, but the current spread and the current surge is Omicron. Next slide. What we have learned is testing is important. These are the recent, just over the last few days, test positivity rates, and you can see the test positivity rates are rising in all age groups. all age group except for 5 to 11 years old. But the largest number of confirmed hospitalizations, again, that top dotted line, are individuals over 70, followed by 60 to 69. And this is going to continue to drive stressors onto the hospital and the staff. Next slide. So everybody wants to know about Omicron, but you should know one thing. Omicron developed out of a quiet period within South Africa. As you can see, there's 6 months between each of their peaks. There's a valley in between, and this is reflective of the durability of natural infection protective immunity from infection, which is under 6 months. And so it's not surprising that the protection against vaccine infection with vaccines alone can be around 6 months also. And you see that over the last 6 months, protection in those who have been vaccinated against infection, not protection against severe disease and hospitalization, but protection against infection wanes and wanes significantly. That's why you hear people talking about boosters, but we do not, and I want to emphasize this, we do not know the duration of the booster protection against infection, which is very different than vaccines protection against severe disease. That has been holding severe disease and hospitalizations, but you know, as I know, that you have to have an immune response in order for the vaccines to be effective. And certainly in those with immunodeficiencies and those that have significant age-related immune senescence, that means your immune system is old, like we are, and some people in their 80s and 90s may not develop an effective immune response. Next slide. So you all know about the Omicron variant. I know it's the new shiny variant, but understand that what we're seeing in the Northeast, the Northern Plains states across the upper Midwest is the Delta variant. And therefore, the current vaccines that we have are protective against severe infection with the Delta variant. And that's why you hear us talking about the importance of immunization. But we also want to protect the patients, and we want to protect them against hospital-acquired infections that are on the rise because of the stress that our healthcare providers are under. Next slide. Now, I think you also want to know, will the Omicron variant take over the Delta variant? That will, if it's going to happen, it will take 3 to 4 weeks for that to actually happen, because the Delta variant is 2.5 times more infectious than our original variant. The Omicron variant is only 3.5 times more infectious, and so they'll be competing head to head. We're looking at Europe right now to see how effective that is. So just to summarize where we are, this winter we're carrying a higher caseload than we did into last winter. We are already experiencing the post-Thanksgiving surge. There remains a high degree of circulation now among both non-boosted vaccinees and unvaccinated people with mild to moderate disease that may be transmitting virus to others. And so your nurses and doctors and your health aides that are not boosted could actually be subclinically infected with the Delta variant, and subclinically infected and thus passing on to others. And that's why testing and other resources that transcend what human resources need to do, that actually can work in the background and protect your patients from both COVID-19 acquired hospital infection as well as other hospital infections. Next slide. I'm not going to go through the variant. We know we're in Delta right now. We have tiny number of the 100,000 cases a day, probably somewhere around less than 100 to 200 are the Omicron variant. So 99% of all the cases today are the Delta variant. Next slide. So not that you need a reminder of how this virus moves, but it moves in a very predictable way now. So this is where we were in April of 2020. Next slide. Very much an urban pandemic that primarily in the Northeast, Chicago, Detroit, New Orleans, and the tribal nations. So I use this Four Corners area to really illustrate the tribal nations have had the highest infectivity, highest hospitalization, and highest fatality rates of any race and ethnicity in the United States. Next slide. The entire country began to improve in late May, early June, but then Memorial Day hit. Next slide. And that started the entire Sunbelt, next slide, Sunbelt surge that went across the southern part of the United States. Why? because when it's hot, people move indoors. And so the primary driver of COVID infections are friends and family gatherings, probably the absolute same for flu. Next slide. That began to then improve in September, but the northern part of the United States cooled in September last year. This year was the hottest October on record. And so the virus spread much later this year. Next slide. That triggered, next slide, this entire surge. That was the winter surge of last year, the most deadly. We lost 300,000 individuals. Next slide. Very much aggressive throughout the country. Started to improve actually before Christmas. And by January, beginning of January, we peaked. Next slide. Improvement across the United States. Keep going, Marissa. Next slide. Next slide. Next slide. And so when you get to April, next slide, and May looks a lot like last year, and June looks exactly like May last year. Next slide. So the country again was very quiet. Cases were way down, and then it got hot across the South. Next slide. And virus with the Delta variant erupted again across the Sun Belt. Next slide. And that continued across the Sun Belt primarily. You can see a little bit of light pink in the Northeast, but nothing like the dark red of the Sun Belt. Again, September, that began to improve. Next slide. Next slide. And now you have the movement up into the Northeast, up into Minnesota, up into Wisconsin and Michigan, where it has cooled. Next slide. And so in November, we have cases rising in the cool areas of the United States as people have moved indoors. Next slide. And this is where we are. This is where we were exactly last week. And you can see how dark red those counties are going. Now you can find these slides at all times. They're on HHS Community Profile. We've been putting them up. We started them in November of 2020. They continue to be refreshed. It shows hospitalization, cases, test positivity by counties across the United States. Next slide. And so these are the areas of concern, just as we stated. It has moved up into the Northeast and into the tribal areas of the Rocky Mountain states in New Mexico and Northern Arizona. Next slide. What's important, I think, for everyone to realize is vaccination alone. And I show you that 10 on the top and that 10 on the bottom. This is a university that tested weekly. And they had more, and they're 97% vaccinated. And they were our insight into these breakthrough infections. If you remember, the CDC was not measuring anything but severe and hospitalization and death breakthroughs. Colleges were measuring what was actually happening on their campus. And you can see they had more cases this year than last year. They're testing weekly. That's because everybody's doing more. Everybody's out and about more, but these are all asymptomatic breakthrough infections. Next slide. And so when it comes down to protecting indoor spaces, I hope I've left you with the concept that hospitals are going to continue to be under pressure because they were under pressure in the areas that didn't have a high COVID outbreak because of the human resources and the stress from the last surge. That then all of the residents who had underlying medical problems that didn't seek medical attention end up in your emergency room and then in the hospitals. Staff are overwhelmed, beds are short, even between and quiet COVID times. And without testing your staff and without testing your residents, there could be among the vaccinated asymptomatic spreaders that puts more stress on the symptoms. And that is what, next slide, is leading to increase in hospitalizations and in hospital-acquired infections as people are pushed to the limit. I wanted you to see that this level of surges and the continuing surges are going to continue to happen, though they'll become more and more attenuated from the hospital perspective. But as you know, with each of these variants, if they become more contagious, there'll be more asymptomatic spread in the community. And across this country, we have about 18 million colon pals that are susceptible, even though vaccinated, to severe disease. Next slide. So this is just a summary about active virus in communities, the continued stress on the healthcare delivery system. Next slide. And what all of that stress together, next slide, is that stress together at the healthcare delivery site. And I had a colleague that got sick. I spent the last Thursday night, 6 hours in the emergency room, waiting room, because emergency rooms are full. This is non-COVID time in DC. We don't have a lot of COVID cases. What was holding everything up is bed turnover on the floors resulted in poor bed turnover in the emergency room, which resulted in emergency rooms being full, even in a time of low COVID cases. This is putting huge stress on the hospital system. That has resulted in the first significant increase in hospital-acquired infections that we have seen in the last decade. Next slide. We all know the deep cost from that, and I want to thank Marissa for this excellent slide that really highlights just over the green is the last quarter of 2020. You can see this constant increase throughout the acute time of COVID and even now into where we are presently. Next slide. And I think we all know what this is happening from. One, when patients get to the hospital because of the delay of medical care, they're sicker. They require longer in-hospital stays. Longer in-hospital stays increase the risk of hospital-acquired infections at a time when we have significant staffing shortages that are only get worse. I know you know this, but our community colleges are a lifeline for EMT and nurses, and they significantly decreased their class sizes over the last 2 years because of COVID. So our nursing pipeline is reduced at a time when we need significantly more. Next slide. And so when you talk to staff, I talked to staff who were taking care of my father. They are really exhausted. There has not been a physical break because when people see that the COVID outbreak is decreasing, then they go to their doctors with seeking medical care and end up being hospitalized for medical conditions that got out of control while they were waiting for COVID to clear. And so this stress, so those of us who are not in the hospital every day think things are getting better, but for the hospitals, they haven't had a break in over 20 months and have been working at that level. Next slide. And I think this is really a very good quote. And it says that basically we've lost a decade of progress. And I don't think this is no one's specific fault. And I think what you'll hear about today is how to really address this issue in a time of real staffing issues and really the stress from our nursing assistants through our nurses, through each of our therapists that attend to our patients, into our doctors and nurses, just a real, when you're under that much push and moving that many patients, it's what will happen. In addition to the risk of patients from asymptomatic COVID infection that are in their care providers. And so this taken together, I think everyone is looking for a non-human dependent ability to combat hospital-acquired infections. And I think that's what's exciting to me about what ActivePure as a class 2 medical device holds. And the opportunity that it holds. I'll finish with something I learned from Governor Ivey, governor of Alabama. And what she said to me is, there's not anything that's 100% in any of these, in the same way with hospital-acquired infections. And she loves talking about Swiss cheese and how you have that first layer of Swiss cheese with all those holes, and you layer on another layer and you layer on another layer. And by the time you get done with 4 layers, you don't see any holes anymore. And that's what's possible when you combine what we know is effective of hand washing and surface decontamination to what we know about non-human dependent active mitigation through improving your air and surface decontamination in a continuous 24/7 operation that allows it to function independent of, we're not perfect. We make mistakes. We make mistakes about hand washing. I'll never forget John on one of the webinars when he showed how little we wash the backs of our hands. I've gotten better about it, John, but that was, I mean, that hand that he shows, it's scary to me. And we all do it. And I was trained how to wash my hands in a surgical OR. So we have no excuses, but we're not perfect. And I think finding solutions that allow an additional layer of that Swiss cheese without someone actually having to intervene, that runs in the background and protects patients and nurses and doctors and health assistants. So thank you.
Dr. Birx, thanks very much for the for this interesting and really informative presentation. I just want to open it up before you sign off. I just want to open it up for any questions for Dr. Birx. So Marissa, if you could open up the lines. Dr. Birx, you know, as we sit and we wait for a question, I would ask you if there is one thing you want the listeners to take away from your presentation, what would that be? Just one thing out of all of this great information.
Data, 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 data. And I think, you know, we learn something every day. It's hard to keep up with everything. And I think finding a way to provide a simple clearinghouse that informs people where viruses are, definitive diagnosis of respiratory viral diseases, and definitive treatments. We have to move our healthcare delivery and our data into the 21st century and use the tools that have been available to us all along that we hadn't been using. We should never accept presumptive diagnoses again, either in the clinic or the emergency room.
Okay. All right. Dr. Birx, thank you so much for the presentation. We really appreciate it. And again, if we get any newer questions as well, we'll be sure to present those to you so that you can answer them and we can get them back to the Vizient team.
Thank you. Thank you for that. Let me just thank all of you and by thanking you. You saved my father's life, and what you do every day is valued. I know it's hard, and whatever we can do to support you and the industry responded, and the private sector responded, and I'm really grateful.
Very, very well. Very well. Thank you. All right, moving on to our next speaker. Thank you, Dr. Birx, for highlighting the impact of COVID-19 on the healthcare workers. I'd like to introduce John LaRochelle, who will highlight areas of risk and the importance of getting back to the basics. John LaRochelle is recognized as a subject matter expert in infectious prevention. He's got over 35 years of experience. He launched his career at Sodexo, where he started the housekeeping and then rose through the ranks to become a global executive before starting his own company dedicated to ensuring safe facility and environments. If anyone knows about the importance of cleaning and disinfection, it's probably John LaRochelle. It's probably got his name on it. So as he presents, please be sure to add any questions again in the Q&A box. And we'll address those at the end. I want to thank John for joining us today. John, you can go ahead and take it from here.
Okay, Alister, appreciate the introduction and welcome everyone. I very much appreciate your time. And if there's one thing that we've learned from COVID is that we really need to get back to the basics. We need to look at all the foundational things that lead into environmental infection prevention, everything that goes into that Dr. Birx was kind of talking about, because, you know, the reality is this is not a one-time event. Next slide, we'll kind of go through quickly a lot of these things, but, you know, COVID has taught us that cleaning, disinfection, indoor air quality, hand hygiene, all these things are vitally important. It's kind of a recipe or a portfolio approach. And if you skip one, then you can have failure points throughout your organization. So, you know, my team's job is to work with hospitals to help with COVID mitigation, but also with all the MDROs that we've been fighting, whether it be C. diff, MRSA, VRE, Candida auris. But, you know, COVID isn't a one-time event. And, you know, as I travel the globe and work with organizations, you know, cold and flu is extremely debilitating to many organizations. Norovirus, the simple stomach flu, you know, H1N1, a lot of these things are continuing. This is nature. Nature learns to adapt and defeat us and what we're putting against us. So, you know, although COVID is here and it's going to be here with us for a while, you know, we need to not take our eye off the ball of many of these other things, because you see HAI rates going up in hospitals. A lot of my clients have seen this, and we just need to redouble our efforts to the basics that we need. So next slide, we're going to kind of start to go through some of the studies that we've talked about and that are published, either peer-reviewed or otherwise. But one of the first ones I'll show you is from Dr. John Boyce, one of the top infectious disease doctors in the world. And he studied how many organisms in the Petri dish on the left side was on a patient room bed rail before cleaning, and then showed the amount of pathogens on that bed rail after cleaning. And this really became the foundation of my work and my desire and passion to make a difference, because in the cleaning industry, as a former housekeeper, we a lot of times are simply making the problem worse. Not because we don't want to make a difference, just there's a lot of failure points in the people, the process, and the technology they've been using. So next slide, we'll kind of go through a lot of these failure points. One of the first ones, and most important, was a study done by Dr. Philip Carling, where Dr. Carling put invisible markers throughout the patient care environment and studied what percentages of those surfaces were actually wiped by cleaners. And astonishingly, only 49%, less than half of the surfaces, are being wiped by a housekeeper on a daily basis. You know, we've put more on the housekeepers than they can really handle. We don't give them necessarily the best disinfectants and the best products to use. And we're paying them on average, national average rate is about $12 an hour. So Dr. Birx talked about a lot of labor shortages. Housekeepers are decimated in the industry in general in trying to find workers. So they're doing more and more with less and less. So next slide. This is actually showing how long pathogens live on surface. You know, we all know that COVID can last days to weeks, depending on the environment it's in. But you look at C. diff, 5 months, MRSA, 9 months. And with the understanding of dry surface biofilm, which these pathogens are working together to create a secretion to live in on a dry surface, and it can extend the life much further than these. So this is a continuous and ongoing problem. Next slide. And also, we understand now that cleaning, even though we clean and disinfect the surface, even within 4 to 6 hours, the bacterial level, if we don't get that organism count down to a low enough level, can actually replicate and reproduce themselves and regenerate right back up to the same place within 4 to 6 hours that we started before cleaning. So it's a dramatic challenge in the industry that we have to continuously understand. Next slide. So one of the most dramatic to me studies was floor care in the healthcare environment. One of the groups that I work with, a nonprofit looking at infection prevention, studied hospital floors, and we found that over 90% of hospitals didn't disinfect their floors on a daily basis, even in the patient rooms. And of those, when you had a C. diff patient, they weren't even using a disinfectant that was EPA approved for this type of organism. So what Dr. Donsky had done and his team is they inoculated patient room floors, and they studied over time where that pathogen went. This is a harmless surrogate pathogen, but it kind of demonstrated the problem. Within 2 days, 62% of the patients had that pathogen on their hand. 62% of the surfaces also had the pathogen on it. And the pathogen had started to migrate throughout the building. So this is a dramatic challenge that we absolutely have to continue to address. The floors are the larger surface, and you know, if you're not even mopping it with a disinfectant or any type of sanitizer, you're really missing a large opportunity. Next slide. So the next one is Dr. Charles Gerber, University of Arizona, great colleague. We've done a lot of work with him, and he's studied mops and cloths and that are being laundered on site. And I can attest to this. The chart you see on the right-hand, bottom right-hand is actual hospital in the Boston market, where we tested mops and cloths that came out of a commercial laundering unit after they were cleaned at this hospital. And they were found to be still highly contaminated. So a lot of the housekeepers that we're finding as we're doing our due diligence and studying what's going on in their building, we're finding the mops and cloths that they're using are starting out the day already contaminated. So it's a challenge that we face and that needs to be continuously addressed. Next slide. Disinfectant failure points. You can have the best disinfectant in the world, but if it isn't being used as designed, which we find in a lot of places, you're not giving it enough contact time wet on the surface. It's designed to be a spray only, and you're using it as a mop application or a wipe application, and we see this a lot. Or it's not effective against that dry biofilm where the organisms are actually living in. So you really need to follow the EPA guidelines. Are you using it as a spray? Are you using it as a wipe? Is this the actual application that it was designed to be used? And this is a dramatic failure point throughout our industry that needs to be addressed immediately. Next slide. As Dr. Birx has talked about, this is actually a healthcare study looking at how people wash their hands, the competency of hand hygiene. So look at washing it enough times, the compliance is critically important, but if you don't do it correctly, you're really not having success. And what we found in the healthcare environment was that everybody was getting the palms of their hands very well. But in terms of their fingertips, the back of their hands, between their fingers, that's where the failure points were dramatic. And, the way we eat, the way we do care is with our hands, our fingers, and our thumbs. So, better hand hygiene competency is dramatically important. Next slide. So, as I talked about in the beginning, cleaning, disinfecting the environment is absolutely a portfolio. It's a recipe. So you have to do everything in order with the right ingredients, the right order, and the right ratio, or you're not going to get a good result. Just like when you're baking a cake, you're going to get that poor result. So you got to get the surfaces, the hand, you got to get something that's addressing the air. And then it does take the right amount of people, process, technology, and then evaluation of where you're doing it correctly and where you're not. Biological testing, understanding where the pathogens are and where they're not, so you can continuously improve it. Next slide. And I think there's another slide. Get a click. And you basically looking at, the foundational solutions really require a comprehensive, continuous disinfection process. When I was a housekeeper, I would clean a patient room in the morning or in the afternoon, and then it would remain untouched virtually for 24 hours. We know all the failure points we've just reviewed, and this is a critical challenge that we need to address as the industry, is we need continuous disinfectant. And if you look at the next slide, as you talk to the infectious disease specialists, Dr. Chen, Dr. Atella, they all agree that the continuous disinfection is where the industry needs to move to. We can use UV, which is a great technology to disinfect a surface. We can use the best-in-class disinfectant with, the right people, the right process to make sure we eliminate all those failure points. But the challenge is those are all episodic. They're one-time events. And then the minute that patient touches the surface, or a visitor or a healthcare worker, even in the perfect situation, you're going to get reinfection. You're going to get the bioburden increase. So the continuous process is absolutely where we need to move to. Okay, and thank you very much for your time. I'll take all the questions, I guess, in the end. Thank you.
Thanks, John. I really appreciate it. Just before I move on, I just want to ask, are there any questions from any of the folks that are listening in? Marissa, open up the phone line. Okay. Well, thank you so much, John. Really appreciate the information.
Very welcome.
Yeah, no, you're very welcome. Guys, I just want to move on. As a minority distributor for Vizient, we're really excited to be partnering with ActivePure. Today we have Dan Marsh, president of ActivePure, with us. And I just want to introduce Dan to just provide a few words about ActivePure, about the company itself, and about what we're doing with continuous disinfection of the surface and air. So Dan, I want to turn it over to you.
Thank you, Alister. I appreciate it very much. Appreciate the opportunity. First, I want to say thank you to Dr. Birx, not only for her amazing presentation today, but for her decades of service to our country and to our healthcare system. And John, it's always been a pleasure working near and around you. You know, the work that you and your organization have put forth in terms of helping to improve the environment of care has been transformational. And you know, what I'm here to talk about today is just a little bit about where we think the future is. We know that we've been challenged in the most recent couple of years with the chaos in our healthcare system caused by COVID, between staffing shortages and the severity of the illness and the supply chain shortages. We've gotten away from the basics, not because we tried to, but because it's a function of what we've been doing. I want to talk today about where the industry is going a little bit in terms of what the two words that John was talking about, and that's persistence and continuous. And that's where ActivePure comes in and makes a difference. It provides continuous disinfection in an environment where all of us are living with shortages in staffing and inability to get done the normal things that we do. Marissa, change slide. So John just talked about how important it is that you optimize what that episodic intervention looks like. We know that we have to use the right chemicals and the right substrates and get back to the basics in terms of training and using, you know, very unique and simple strategies for monitoring what happens. But that's just not enough. Marissa, what we have to do is we have to solve for the problems that we're faced with today. We know, based on what John just shared with us, that 50% of the time we miss the high touch points that we need or should be cleaning and disinfecting. We also know that as soon as we finish cleaning and disinfecting a patient care area, a nurse's station, a public area, that area is rapidly recontaminated. And now with the current public health crisis, we know that aerosolization of pathogens is a very, very vulnerable area in what we're doing currently. When we first took this technology to Dr. Ratala and to Dr. Mike Bell at the CDC, they were excited about the opportunity to use this kind of technology to add another layer of protection to supplement what's already been being done and to engineer out some of the human factor. So real quickly, what we're going to talk, I just want to give you an idea of what we're talking about in terms of the technology. It's an advanced form of photocatalysis, and the technology is designed to take the humidity and the airflow that we create continuously in the hospital and change the water molecules in the humidity into oxidative molecules. Again, when we took this to our thought leaders, they were very, very excited about the fact that what we're doing is creating molecules of very, very effective oxidative molecules that are very effective against pathogens. When we first came out with this technology, there were issues associated with how much output you could get, how effective you could be. And in the work that's been done over the last 8-10 years in terms of new iterations, we now have a product that is ozone free, that is creating gaseous hydrogen peroxide at levels that are super effective against the pathogens that we face in the healthcare environment. And more important than that, it is safe to use in occupied spaces. And that's been a problem with all the technology. Marissa, go ahead. The technology that has been shared to this point. We've tried UV lights, the robots, we've tried H2O2 misters. And while they're effective against pathogens, they can't be used in occupied spaces. They're capital intensive, they're labor intensive. And most importantly, they're still an episodic approach, right? We roll them into a room, we do a terminal cleaning, we roll them out of the room, and the room immediately becomes recontaminated. And it's not practical to use in the whole hospital. So that's the difference that ActivePure provides, an ability to continuously add highly effective oxidative molecules into the environment while it's occupied, covering everything from patient rooms to nurses' stations to public areas to floors and hallways, even equipment. This is a demonstration of how the technology works. Marissa, you're gonna have to do the sound. I'll talk over what's going on. Marissa, can you start it over and I'll talk over?
I can play it with sound. Do you want me to do it again?
Yes, please.
Okay. Please confirm y'all can hear it.
Microscopic oxygen and water molecules in the air are pulled into the ActivePure purification system, where they pass through the ActivePure honeycomb matrix. As they pass, the molecules are instantly transformed into safe yet powerful oxidizers. They are then projected into the ambient air, where the molecules rapidly destroy harmful bacteria, viruses, mold, fungi, and VOCs in the air and on surfaces. In some cases, ActivePure is combined with HEPA filtration, non-ozone ionization, and activated carbon to optimize its impact.
So these are that product that you just saw is a product that's designed. It's a class 2 medical device with FDA clearance. The key of having clearance from the FDA is the two words that they provide: safe and effective. We were required to go through a long battery of proof in terms of our ability to eliminate pathogens up and down the entire hierarchy of pathogens. And secondly, we were required to demonstrate that we were safe to use in an occupied place. This product is specifically designed to be used in an operating room environment and is currently used in every OR in the Cleveland Clinic. Marissa, go.
This is how pathogens such as SARS-CoV-2, the virus responsible for COVID-19, spreads throughout a waiting room from patient to patient if untreated. Slow and ineffective technologies like HEPA filters or UV lights only treat the air that goes through the filter or the virus and bacterium directly exposed. ActivePure technology takes a proactive approach by continuously filling the room with powerful molecules, including gaseous hydrogen peroxide, that quickly attack harmful pathogens as soon as they enter the space. ActivePure is effective against a broad spectrum of airborne and surface pathogens.
So the real important thing to take away here is there's lots of different strategies for cleaning and disinfecting the environment of care. What we don't have right now is something that can fill a room with effective oxidative molecules that attack both pathogens in both the air and on surfaces. These are the two workhorses. We have lots of products in our offering, but the product on the left is the FDA cleared class 2 medical device that is designed specifically for operating rooms. The product on the right is our induct unit, which goes actually in the ducting of the HVAC system. And in the environment that we create in the hospital, which is continuous airflow with a humidity between 40 and 60%, these products will be continuously creating very, very effective technology that fills the space and actively attacks pathogens where they are. To give you an example, we did a study at UTMB in their biosafety lab against what was a log 7 introduction of nebulized aerosolized SARS-CoV-2. we were able to reduce that aerosolized SARS-CoV-2 from over 10 million plaque-forming units to undetectable within 3 minutes. So that in itself shows that we can fill a space and actively reduce pathogen counts down very, very, very quickly. Next slide, Marissa. And again, in order to get the clearance, we all know that SARS-CoV-2 is a envelope virus, relatively easy to kill, but we have much, much bigger challenges in the hospital between the viruses and bacteria and molds that we're faced with every day. This is an example of how quickly we can get a 4 to 6 log reduction against some of the bigger problematic pathogens that we face on a daily basis. Next slide. And again, I just want to reiterate the hierarchy of pathogens is very, very important. SARS-CoV-2 being at the bottom of this pyramid, but we've tested against pathogens that are much more difficult to kill, all the way up and including testing against C. diff spores. So the product is designed to reduce our biggest challenges as it relates to pathogens, and has been effective up and down the hierarchy. Next slide. Lots and lots of healthcare facilities are challenged right now with what do they do to, especially with the current healthcare crisis. Lots of people are looking at trying to increase UV lights, to increase HEPA filtration. It's putting large amounts of strain on their air handling system. This is a test that was performed after a hospital had made a $30 million investment in improved UV and HEPA filtration. Then they put in the ActivePure induct units and were able to significantly reduce the surface and air contamination even after that $30 million investment. So if you take a quick look, it's bacteria and fungi were reduced by close to 90%. Surface staph was reduced by 97%, and airborne particles were reduced by 2/3. As I said before, there is a whole bunch of products in our product offering. These are the main products. But what we do is come in, take a look at the space that you're interested in adding supplemental help, and we do an analysis and assessments of what you're currently doing, what the current environment is like, and then we provide you with a custom configuration that can solve and provide that added layer of protection. The company has been around for a long time. It's not a COVID pop-up. We've been working on this infection prevention solution for years. We have millions of customers across the world and are really very excited about our relationship with AMX and Vizient, and are looking forward to continuing to bring solutions into that infection prevention space with you. Just a quick summary, what we're designed to do is to decrease HAIs. We do that by bringing down the microburdens and reducing the amount of clinically relevant pathogens. If we can, in this day of value-based purchasing, help you improve your quality scores, we can increase revenues and lower expenses. And in this time when we're all struggling to get by with, very, very big challenges in staffing, the product also helps turn over rooms. It lowers nursing time in the way that we don't have to work on as many infections. And in one study that we did in Unity Point, St. Luke's, we actually demonstrated that not only are we keeping patients safe, but we're keeping employees safer. We were able to reduce employee sick days by 42%. So all of this is designed to increase patient satisfaction, and in a time when we're all a little bit worried about what's going on in our environment, it helps with the staff satisfaction as well. Again, I just really want to thank you for giving us your time today. We are all very, very appreciative of all the things that you do every day to keep patients safe. We between Caitlin and myself and Alex, we have decades of infection prevention background. And not only do we come in and help you provide the ActivePure solution, but we'll come in as a partner to take a look at what you're currently doing, assess what what might make the process a little bit better for you, and we're there as partners long term. So please feel free to contact us, and we would be happy to provide infection prevention assessments in any one of your facilities.
Dan, thanks so much for doing that presentation. That was really good. We're really excited as a company, especially as a minority distributor with Vizient, to be able to work with ActivePure. Before you go, Dan, I just had a couple of questions here that I wanted to address. One was for John and one for yourself. So John, if you had to summarize, based on the information that you provided for us, one of the most common mistakes within the hospitals, could you just speak to that very, very briefly?
Yeah, people are trying to do one or two things, and it's really a portfolio approach. They need to do multiple things, making sure the disinfectant works, making sure the indoor air quality is sufficient, hand hygiene. So it's really a recipe and a portfolio approach, and getting to people to understand that a lot of what we're doing in the housekeeping world is a one-time event, and nothing happens for another 24 hours. So that continuous is pretty critical.
Awesome. And then the second question is for Dan. Dan, it's been a pleasure to work with ActivePure so far. One of the things I enjoy most is that we first go in, work with the customers and the clinicians to assess the environment before we ever place a device. In keeping with that, the question is, in recent environmental testing, what has been the most shocking information that you've seen?
The more you do it, Alister, the less shocking it is. The bottom line is the environment of care is inherently dirty. We can't help that. And we work real hard at getting that episodic intervention right. But the fact of the matter is we don't always do it perfectly, and there's recontamination that occurs continuously. But what I will say is that I think that the thing that shocks me the most is the lack of understanding that if we put the right processes in place and we put the right bundle in place, that we can significantly and sustainably improve the environment of care. You just got to want to do it. And so, we have lots of improved products and processes, with the last 2 years, it has been just chaotic, right? So if we can all get back to basics, John and his team, my team, stand ready to come in, provide an assessment, and give you simple ideas and there's simple little tricks we can put in place that make corrective action and absolutely improve the environment of care. We've done it over and over again. It's not hard. Give us an opportunity and we'll come in and help you improve that environment of care in your facility.
Well, thank you. And thank you to John LaRochelle, to Dr. Deborah Birx for all the great insight. Thank you, Dan, for sharing the information on ActivePure. I just want to say finally, with the last minute or two that we have here, that American Medical Exchange, it has been a pleasure for us to work with Vizient S3P, in particular in working with Kristen Allen and the head of diversity supplier experience, and that's Brittany Bray. It's been a real pleasure to work with you guys. American Medical Exchange, so you know, has recently been awarded an automated room disinfection contract. The contract number is CE7510, CE7510. So there are a couple of ways to get it. You can easily go into your system and select CE7510. You'll have all the information. You can reach out to myself. My information is in there as well. You can also reach out to the team at Vizient, Brittany Bray. We're already working with Vizient right now in your healthcare systems. So we're really excited about that opportunity. And again, I just wanted to thank you guys for your time. We'll be sending out some information to folks who joined us today after today's meeting. So you'll have that as well. But if there are any other questions that we can answer for you, please reach out to us. We've got a plethora, as you guys have seen from the meeting, we have a plethora of experience here, and I'm sure there is something that we can help you with, as well as obviously the ActivePure units for continuous surface and air disinfection. So thank you for your time today. I hope you have a wonderful rest of the day and a Merry Christmas. Thank you.